Hello friends, today I am going to discuss with you the impact of fibroids on fertility. The questions are: do fibroids affect fertility? Which fibroids affect fertility? How fibroids impact fertility? And to treat or not to treat, that is the question. So we will try to evaluate the precise impact of fertility fibroids on fertility. The first thing which is important as far as fibroids are concerned, I think, is proper mapping of fibroids. And that is the first step which you should do properly, which requires, of course, a good ultrasound machine, if possible, with 3D ultrasound. And in case you need to evaluate it further, in some situations, you may require MRI. Once you do the fibroid mapping properly, then you have to follow the FIGO classification, and depending on FIGO classification you know what is the exact location of fibroid, whether it is FIGO class 0, 1, 2, 3 or 4, 5, 6, 7. Now 0, 1, 2, 3 are the fibroids which are submucous fibroids or the fibroids which are indenting the cavity, and there is no question of not removing such fibroids. The problem is with the intramural fibroids and the subserous fibroid, and that is where there is a controversy. So friends, the first thing is, how does the fibroids cause infertility or the problem with fertility? The first thing is physical impact, mechanical impact. Second point is uterine contractions, and because of uterine contractions the fibroids, they create a problem with the implantation. Cytokines are the factors which play an important role, and the endometrium is affected even if the fibroid is intramural or away from the cavity, and it may hamper implantation. And the genetic factors like Hoxa10 is something which is said to have its impact on the implantation of the embryo because of the fibroids. So the question is to remove or not to remove the fibroid. And friends, you have to remember few things. Any fibroid which is submucous should be removed irrespective of the size. And it is said that any fibroid which is more than 5 cm should be removed irrespective of the location. Now here we will go into the more details of the fibroid which is not submucous. Now suppose the fibroid is intramural and it is not interfering or indenting the cavity of the endometrium. What will you do? In such situation, it is said that if there is no other cause of infertility, that means the patient has got a fibroid and otherwise it's a case of unexplained infertility, but the patient is not conceiving, in that situation you should and you must remove this fibroid because maybe it is the cause of infertility. Now, the size of the fibroid. There are various studies, and most of the studies have said that 5 cm fibroids or more than 5 cm fibroids should be removed even if they are intramural and not indenting the cavity. And nowadays there are some studies which are coming which say that 4 cm fibroid should also be removed, and usually we at Omega follow this, that we do myomectomy in the patients where the fibroid is 4 cm or more than 4 cm even if it is not indenting the cavity. Now this is about the intramural fibroids. And suppose the patient has got a subserous fibroid. The fibroid is subserous, it is maybe 3 cm in size, and there is no impact of this fibroid as far as fertility is concerned. The studies and all the guidelines clearly mention that any subserous fibroid, there is no need to remove this fibroid. So now the things are clear. How to remove the fibroid is something we all should know, and nowadays there is no question of open myomectomy. It is the laparoscopic myomectomy which is preferred, or hysteroscopic myomectomy which is preferred depending on the location and the size of the fibroid. You have to be careful while doing hysteroscopic myomectomy because the chances of fluid overload and complications are more with hysteroscopic surgery, and you need skill to perform hysteroscopic myomectomy. So that is all about fibroids and fertility. Thank you friends. Thank you.